Today we're going to talk about Wobblers Syndrome in horses.
My name's Nicole Paris.
And I'm Jessie, Oldham.
Wobblers Syndrome refers to a number of disease states in the horse and is a neurological condition. It is most characterized by the malformation or compression of the spinal cord. The damage or compression of the spinal cord can cause ataxia, spasticity, and incoordination. The signs and symptoms of Wobbler syndrome usually begin gradually and may appear in the early stages as a mildly stiff neck and abnormal leg placement. As the spinal cord becomes more compressed, the signs gradually become more obvious. You may notice that the affected horse's wobbling is worsened. Another sign is that ataxia increases, which means the horse lacks more awareness of where their limbs are placed, not only at rest, but also while in motion. The horse may also start to demonstrate weakness in the limbs, resulting in dragging of their toes and a decreased range of motion. The other possibility that may be demonstrated is hypermetria, which is the increased range of motion due to the inability to control movements in a normal range. And finally, they may show signs of stiffness, which is often observed as a decreased flexion of the hock and stifle joints. On this slide, we are showing you a video of a 3-year-old stallion who is recently diagnosed with Wobbler syndrome. The primary areas that can be affected are the brain, neck, back, and pelvis, or a combination of any of the above. The exact cause of Wobbler syndrome is unknown. However, it is believed to be caused by several factors, such as genetic predisposition, nutritional imbalances, rapid growth, and physical trauma. Researchers have even suggested that the syndrome is related to neck length, implying that the longer the neck, the more likely it is for the horse to develop this condition.
Diagnosing Wobbler syndrome can be done with radiographs that reveal lipping, flaring, and evidence of lesions or stenosis of the vertebrae, as well as myelograms which show status cord compression by using radio-opaque dye. Diagnosis without veterinary techniques includes observing uncoordination of the rear legs and difficulty backing up. By turning the horse in a small circle, the horse will swing its rear legs out while making the turn, which makes this technique a quick and easy method to detect symptoms. An additional yet unconventional technique for diagnosis is to use the tail. Walking the horse forward and pulling its tail to one side can serve as an aid. An affected horse will easily be able to pull to the one side, while an unaffected horse will keep walking straight. Additionally, picking up the tail and feeling no resistance can indicate a problem with nerve function in the spinal cord. Thoroughbreds, quarter horses, and Morgans are the most commonly affected breeds. The only breed that has escaped diagnosis is miniature horses. Treatment for Wobbler syndrome is limited to a degree. Drug therapy includes the use of osmotic agents such as mannitol and DMSO, diuretics like furosemide, and steroids for spinal cord and head trauma. Although steroids are used, experiments have shown more and more that there is no benefit to their use. Treatment by means of surgery is carried out with what is known as the Cloward method for fusing vertebrae. A final treatment is nutritional management by limiting nutrient intake and increasing vitamin E, and controlling exercise by total confinement. Although there are few treatment options, those known can prolong the life of the affected horse. Non-surgical treatments result in 10% improvement rate in affected horses, while surgical treatments have a 70 to 80% improvement rate. Untreated horses with Wobblers syndrome will result in dramatic degrading of the neurological system and could potentially hurt itself or others when struggling to get up. So many affected horses that go untreated get euthanized. In conclusion, be aware of the symptoms so your horse can be diagnosed properly and get adequate treatment. These are our resources.
Thank you for listening.